right, great. So I'm so thrilled that you are here with me today. And I am really curious what you will share from your experience. Because, as you might know, my name is Karolina and I started to spread knowledge of Ayurveda among women here in Czech Republic and Europe. And I can see a huge potential in Ayurveda and holistic science to really help women heal from their imbalances, to make them feel better, and not to make their bodies even more wasted by any toxic supplements they might be using, because they just do not know, they do not have the awareness.
Yeah.
Right?
Yes.
And maybe before we start, can you share a few words about yourself? How have you started? What brought you to Ayurveda and also to women? Because you are also focused on women healing.
Yeah, definitely. So, myself, Dr. Aarti Patel, and I have done my post-graduation specialization in the field of Ayurveda in gynecology. So, women-related issues. I treat women-related issues exclusively with Ayurveda. So, right from the childhood, Karolina, I was in a love with Ayurveda, because right from the childhood, my parents used to treat small disorders that I used to have, like fever. The child is usually having a lot of things like fever and common cold and this and that. For all these issues, my parents used to, always used to get me to a doctor who used to practice Ayurveda. And that's how my love towards Ayurveda started. I have seen that it has tremendous potential. And I was never on antibiotics right from the childhood for any reason. All the time, Ayurveda has helped me a lot personally. And also, I have seen many people who have benefited out of Ayurveda, like many chronic disorders and period-related issues. All those things I'm experiencing right from the childhood. Then afterwards, once I completed my undergraduation, being a woman, I was really always attracted towards gynecology department, and that's how I choose to do my specialization in the field of gynecology. I completed it from a very nice college where there are many women who are getting treated for their gynecological issues with Ayurveda, and they are having tremendous benefits out of it. They are having root cause treatment for their disorders, and I have seen that without taking any hormone, without taking any antibiotics, without taking any painkillers, they have recovered very well. And that is something which has really built confidence, and I decided that yes, I'm gonna take this and I'm gonna work with Ayurveda exclusively for women and nothing else. And
wow,
Gynoveda, I will like to say that we are three: Rachna Gupta, Vishal Gupta, and me. We three are the founders. So Vishal Gupta is the founder of the company, and Rachna Gupta and me are the co-founders. I'm also a chief doctor here. So Rachna and Vishal, they both are really obsessed with women health issues, and they are also a very strong believer of Ayurveda. They really believe Ayurveda like anything, and we all the three wanted to do some work for women in the field of Ayurveda. So we three are together here in Canada to treat women with the power of Ayurveda.
Yeah, wow, that's amazing. I would love to have more doctors like you here in Europe, because Ayurveda and even Chinese medicine are growing in popularity and trust here. But what we are lacking is really to have a holistic approach in gynecology itself.
Yeah.
I know so many women around me that would love to have such a doctor that is, well educated, informed, at the same time has a holistic approach to their bodies. Because let's take as a beginning, one of the most common issues women are having, and it's a painful menstruation. I know
Yes,
so many women that are having a painful menstruation, and from my point of view, it's one of the easiest imbalance to treat because it's just a little bit of awareness and herbal support and right exercise, and women feel better. And doctors are usually not asking about lifestyle or diet, right? I mean, not in Europe. So I really like your approach, and I love you are here with me. And can we start with this kind of imbalance,
yeah,
menstrual disorders, and maybe painful menstruation as a beginning? Because I can see that very often in young women, especially.
definitely. So, Carolina, I would like to share the basics how Ayurveda looks at women related issues first, and from there it will automatically
Sure.
emerge that how the period pain will be looked at, how the other menstrual disorders will be looked at. So,
Mm.
Ayurveda believes that all the gynecological issues are actually due to faulty diet and lifestyle. And what this faulty diet and lifestyle does is it directly affects the digestion. There is a proverb in Ayurveda called Roga Sarvepi Mandam. That means that all the diseases that women have are due to poor digestion. So once you have some faulty diet and faulty lifestyle habits, that will result into poor digestion, and that will ultimately result in different kind of gynecological disorders. Now, when we are talking about period pain, which is the most common disorder, as you said, and most of the teenagers are actually suffering with this.
Right.
So, yeah, so period pain is assumed as Vata disorder. So there is a very popular Siddhanta or very popular principle in Ayurveda. It is called Tridosh Siddhanta, right? And these Tridoshas are nothing but Vata, Pitta and Kapha. These three are basic constituents of our body. And if they are into balance, it results into health. And if they are in imbalance, it will result into different disorders. So let's consider period pain. All the pain that happen in our body are due to Vata. So during period, what happens is uterus has to contract and relax. This movement is actually controlled with Vata. The special type of Vata which acts at the level of uterus is Apana Vata. This Apana Vata gets imbalanced due to certain lifestyle habits. A woman who do not have proper rhythm in her sleep cycle, a woman who is not eating on time, a woman who is having a lot of stress physically or mentally, whose sleep cycle is not really good. These kind of habits really result in aggravation of Vata, and it results in period pain. So what happens exactly is this Vata will not be acting properly, and the contraction that is coming inside the uterus will be so strong that we can experience, or women can experience, a severe pain during period. Now, what to do in such scenario? What we have to do is there are certain herbs which are supposed to be Vata pacifying herbs. These herbs are targeted towards our reproductive system. Two herbs which are very important when it comes to the period pain are aloe vera and ashoka. So what these herbs do, aloe vera is actually ensures that your ovulation is happening on the time properly. So indirectly, it is helping us to balance between estrogen and progesterone. And at the same time, ashoka is an amazing herb which actually helps in toning the uterine muscles. Uterine muscles will be toned up. So that's why when the contraction is coming, what happens is the blood supply to all the uterine muscles will be limited, resulting into severe pain. So this ashoka tones up the muscles, and this kind of dysphoxia or less oxygen or less blood supply will not result, and it will relieve the pain. It is also a very good herb when it comes to the immunity of the reproductive system. So these two herbs are very popular in Ayurveda when it comes to the period pain. There are two popular combinations. There are two popular classical combinations in Ayurveda called Ashoka Rishta and Kumari Asa. If we use that in period pain, it will give amazing results.
Mm-hmm. Yeah, I really like how you summed it up, that it's all connected, right? Our lifestyle is the main cause of any imbalance, if ever. And what I could observe is that, a trend of today, at least in Europe, is lots of raw food. And from what we know, right, raw food increases or provokes vata to get imbalanced. And especially in young women, raw food is like very popular. So I would like to spread this awareness as well, that not for everyone raw food, especially in winter, is a good option. And what I could also observe is that as we usually sit in our office, right? So many women have a job when they have to sit all the day long, or they do not have enough movement. So what happens is, as you said, that the energy starts to stagnate in pelvic area. The energy is not moving properly. So I'm really advising women to get their body moving, and especially the hips, the pelvic area, to work with the pelvic floor. It's so essential for women, right? Do you agree with that?
Yeah, definitely, Karolina. I can connect this directly with digestion. I'll tell you how. So, as you mentioned, the raw food, anything which is raw is difficult to digest than anything which is cooked, right? So, if we are having a lot of raw food, then what will happen is we are putting tremendous pressure actually on our digestive fire. This digestive fire, especially in winters, as you say, or in a special season, the digestive power is already on toss. And in such scenario, if we are eating a lot of raw food, what will happen is we are putting a lot of pressure on digestive fire, and it will become poor. The food will be undigested, halfly digested. Again, about exercise, as you said very correctly, what will happen is if we are exercising, our appetite will improve. Again, it is going towards, our digestion. So whether it is exercise, whether it is raw food, all these habits that you have mentioned and your observations are absolutely pinpointed and absolutely correct, that yes, these kind of lifestyle habits or food can result into vata aggravation and ultimately in any period disorder, especially period pain. Definitely yes.
Yeah, right. Okay, and what about irregular menstruation? It's also again a vata symptom, right? But many women, they do not have a stable cycle. Their cycle is going up and down. I guess it might be connected often to PCOS, right? But not every time. Can you talk about the irregularity in the cycle as well?
Sure. So irregularity, Karolina, can be of many types, right? One irregularity can be periods which are delayed, and another irregularity can be periods which are coming very early. So if periods are coming very early and heavy, then usually the imbalanced dosha is pitta. When pitta gets aggravated in our body, somebody who is eating a lot of heaty food, somebody who is keeping awake late nights, somebody who is having oily, spicy, deep fried, those kind of food items. Usually what happens is pitta gets aggravated in the body, which is a lot of heat will get aggravated in the body, and it will result into early periods and heavy periods, kind of irregular. Another irregularity is periods which are coming delayed. So delayed periods are usually due to kapha aggravation. What will happen is women who are not moving enough, women who have lack of exercise, sedentary lifestyles, women who are having a lot of stress throughout the day, women whose sleep cycle is not proper, or somebody who is having a lot of sweets in their diet, like white sugar and a lot of refined flour, fast food, junk food, lack of fibers especially. So that kind of food habits results in a lot of kapha aggravation in the body. What this kapha will do is this will reduce, it will make your digestion poor, and this poor digestion will ultimately result into undigested food, and some toxins will be formed. So these toxins are called as ama in Ayurveda. This ama will get absorbed into the blood, and it will circulate all over the body, and it will reaches our reproductive system. Once it reaches to our reproductive system, what happens is this ama is very sticky in nature. So that will get lodged into the ovaries where egg growth is supposed to be happen. So this egg growth will be affected. That will not happen properly. And once this egg growth is stagnant, that is becoming delayed. So periods will also start fluctuating. Periods will also become delayed because that cycle is not completing very well. Ovulation is not happening. So all these imbalances will ultimately result into irregular. If these irregular periods are not treated on time, if this ama accumulation keeps on going on the same speed, a lot of toxins will come to the ovary, and this egg maturation process will be damaged heavily. So in this case, what will happen? Every month, the eggs will be recruited for the development, but they will not reach to a stage where ovulation should happen. So they will remain immature in nature. So all these immature eggs, when they accumulate at the ovary, and when the irregular periods are there for longer duration, it will result into PCOD, what is nothing but polycystic ovarian disorder. And that is the chronic, picture of the irregular periods. If we ignore it, definitely it's going to end up into PCOD like things.
Right. Now, what I'm just thinking, isn't it amazing that we as women have this monthly check if our body is working properly, if everything is going all right or not, because our menstruation is a main reflection, right? If our body is healthy or not healthy. Right. So grateful to be a woman, right?
We are so lucky that God has gifted us this monthly check that our overall health is really good or not.
Exactly. Yes. One last, or maybe not last, but let's see, last topic to menstruation that came to my mind was that here in Europe, women are becoming more and more aware of their cycle, so they are more informed that their hormonal levels are changing throughout the cycle, and there is a phase after menstruation when they are a bit more active, more in a masculine energy, so to say, and shortly before menstruation they go more inward, they are more sensitive, and it's perceived as something good to be aware of the mood swings, etc. But what I have observed that sometimes women understand it in a wrong way, that they feel that PMS, like premenstrual menstruation syndrome, or the mood swings are a symptom of I'm aware of being a woman and I can sense what's happening in my body, but it has certain limits, because when the mood swings are huge, or when the woman is really suffering from a huge headache before menstruation or another symptoms, it's also not all right, or it's also showing some imbalance, right? Can you talk maybe a little bit about that? What's normal and what's normal anymore?
Definitely. So PMS, which is known as premenstrual syndrome in medical language, is something which has a very fine line, what we can understand whether it is normal or whether it's not normal. So as you mentioned, little mood swings, little going inward or feeling little emotional is really natural. But when it comes to when you have an angry burst up or crying episodes for nothing and feeling very lonely and feeling very depressed, these kind of things are not really normal. That is something which is indicative of hormonal imbalance happening in your body. Another thing is headache. Headache is not really a normal symptom that a woman needs to experience before every period. A few women I have seen that they have severe headache when their periods are about to come, or even during the initial days of period, they have severe headache. This is again indication that this is not just a PMS, but this is something abnormal kind of PMS, right? Another common symptom what I have seen, Karolina, is breast pain. Few women will also complain about severe breast pain before periods, and that is also included. If it is really severe, if it is hurting without even touching the breast, then it can be considered as an abnormal PMS symptom. And the very commonest is the heaviness and lower abdominal pain, and the water retention kind of thing. Many women will say that, many women come to me and they say that I feel that I'm putting on weight each time before my period, but they don't understand that that's not about putting on weight, but actually they are suffering from water retention before the period. That's what is happening. Yeah. So all these symptoms, if they are not troubling you, if they are not making an obstacle in your daily routine work, then that's absolutely no. But if any of these symptoms can make you enable, or it makes sure that you are not able to do your daily routine work, that means it is something abnormal. So PMS is something which is heavily connected with our diet and lifestyle. I have seen that women who have very stressful work overall are suffering from PMS. They are very prone to PMS. Again, women who do not exercise daily. Some women who are very, who have lack of exercise also suffer from PMS very badly. And as I mentioned before, disturbed sleep cycle, or a lot of white sugar in the diet, or a lot of non-veg food which is very high in protein all the time. These kind of habits can ultimately result into an hormonal imbalance in PMS. So Karolina, I'd like to share that, see, whatever kind of faulty diet and lifestyle a woman has, once she's having some problem in her diet and lifestyle, then what will happen is her digestion will become poor. But every woman can suffer from different disorders due to the same root cause. So every woman has her own constitution, her own genetics. So there are certain genetically or constitutionally, some part of her body will be prone to disorder. For example, the same faulty diet and lifestyle can result in PCOD in one woman, but same faulty diet and lifestyle can result into fibroids or endometriosis or abnormal PMS in other. So what I would really like to say is, if women know that what's the right steps to take in her to improve her diet and lifestyle, and if she follow that, she will end up in a fabulous reproductive health, and she will not suffer from any gynecological disorder. So there are some golden rules that I like to tell. The first golden rule is actually sleep cycle. If a woman sleep on time and get up on time, that she has to sleep early, get up early, and not to sleep in a daytime. This is a very crucial point that we should understand. This will make your reproductive health really very, very good. Then next golden rule I would like to say is meal time. Our meal timings needs to be really fixed. If our meal timings are fixed, our body already knows that when food is going to come inside, and at the same time all the digestive juices will be secreted and the food will be digested properly. This was the second rule. Third rule is we have to exercise daily. At least 30 minutes of walk is must. That is the easiest exercise to be done, and it is really good if you can do it in the morning time, because morning exercises are very good when it comes to the hormonal balance. So this was the third rule. And fourth, of course, is about our diet. We have to choose the diet which is very easy to digest, which is natural in nature, which is free from fast food, junk food, and lot of refined flour, all those things. Healthy diet, and as you said, of course, not a lot of raw food, raw things should be there. So we have to take care of our digestion. A very simple, a takeaway. If we can prevent, we can take care of that. No gynecological disorder can come near a woman. And apart from that, Ayurveda really says that not only gynecological disorder, otherwise also, if our digestion is good, if we are really taking care of it very well, then no general disorder can even also will be there with us. It will improve our immunity like anything. It will improve our overall health and reproductive health like anything. Yeah.
Right. Yeah, it was really nicely said. And one thing that came to my mind regarding that women health was also the fact that I feel we as women shall accept the fact we are cyclical in nature, that it's not linear, because we live in a world that's target oriented, right? And many women, I feel from my experience, are suffering from these issues not only because of faulty diet and lifestyle, as you said, but also because simply they want to go against the natural flow of their body, and they are panicking even before the menstruation is here, that oh my god, I will need to stop, I will not be productive, I will need to rest, so I feel many women of today also do not know how to rest. Those who are target business oriented, more pitta type women, that it's okay to rest when our days come, right? It's okay to rejuvenate and pause, and it's even essential, I feel.
Yeah, definitely, Karolina. I totally agree. Definitely, yes.
Right. And it's connected with that, the fact that many women, they do not let the menstruation happen in a free way, so using tampons and menstrual cups is blocking Apana Vata actually, and due to that fact there can be also some blockage. So I really encourage women to treat their cycle in the most natural way as possible, right?
Definitely, Karolina. So I think about like menstrual cups and tampons, they are really like mechanical obstruction, like kind of mechanical obstruction in the which can really hamper the flow of menstrual flow. Definitely, it can result into the multiple disorders. Yeah, I totally agree with you.
Right.